Good afternoon. We are pleased to welcome you to our spotlight on caregiving for unique populations. Thank you very much for joining us. This is a very important content for all of us, whether we're professionals, whether we're family members, friends, and neighbors. So this is the second. We're hosting a three-part series on family caregiving. And so this is the second, and then we'll announce the sequel before we're done today. It is hosted by Partners in Care Foundation. I'm June Simmons, and I'm the founding CEO here, and very proud that we have an opportunity in the modern world without anybody having to drive to join together, to learn, to share support with each other as we live in a world of so much change. For us, as a not-for-profit agency, almost 25 years old now, we're very interested in what happens in the home. We're very interested in how people, the full array of our wonderfully diverse population, can have access to remaining in their residence of choice, that they can live in the community, even if they're facing issues that, of challenges to independent functioning, health issues, injury issues, issues of aging. We are really dedicated to full choice, to safe and satisfying community living, alternatives to nursing homes, helping people not go into or not stay too long in other kinds of care settings. We don't give medical care. We work at the intersection of social care and healthcare, as we really work together around health issues to address the social factors that drive health outcomes and that drive choice about where care occurs. But as we know, with the privilege of increasing the frequency of people being able to live in the home, that means natural caregivers, family, neighbors, friends, carry a lot of responsibility they did not used to carry. Some refer to the burden on caregivers. Some find that a very concerning term because this is a labor of love. And so what we know is it's the role of caregiving, which can be complex and demanding, and has many aspects, as you will hear. At Partners in Care, we proudly embrace diversity. We're very, very interested in equity, such an issue in our society, on inclusion. It's central to our mission. And so that's really a central piece in our presentation today. We have experts with us who will help us focus on the needs and the priorities and preferences of some of the unique populations that we enjoy having in our community, and help us think about ways in which we can all work together to ensure high quality services, culturally relevant services, bringing supports to people across age, race, gender, and the ethnic spectrum in ways that work for them, that respect their individual uniqueness. So we did create this three-part series on caregiving in order to shine a light on resources and information that help all of us ease the burden or the significant responsibility of caring for a loved one, and helping to offer strategies for caregiver self-care. Very, very, very important. And support and self-care for caregivers is, we feel, critical. So last month, we offered an overview on the joys and challenges of family caregiving. And there is a recording of that webinar in case you missed it, didn't know about it, had another conflict. And all of those resources from that session will be available on our website, the Partners in Care website, picf.org. So I'm really pleased that today we have, again, a very distinguished panel of professionals who will work together to address this important topic with a particular focus. Their expertise is in caregiving in special populations, people who may identify as Black, Indigenous, people of color, LGBTQ, and also issues unique to caring for younger family members, not only elders. We're really proud that AARP of California stepped up because caregiving is a big issue of concern for them. They're very interested in advancing work in this area. They stepped up to sponsor this series. We really want to thank them for this, their support of this series and the valuable insights that they've shared in helping us really develop and plan the program. So along that line, it's really my pleasure to introduce our friend and colleague, Adriana Mendoza. She is the Associate State Director in California AARP for Advocacy and Community Engagement. And proudly, she's also a board member at Partners in Care Foundation. So Adriana has given a great deal of personal time and focus on helping craft and concept this whole series and help bring in these experts. And so I'd like you to meet Adriana. And Adriana, the screen is yours.
Thank you so much, June. Thanks for your remarks, and good afternoon, everyone. And thank you for joining us today. It is my pleasure to join Partners in Care Foundation and co-hosting this event today, as June mentioned. And ARP works in this area of caregiving, has been working extensively in the area of family caregiving. Both ARP has been supporting family caregivers by advocating for programs such as the paid family leave, statewide and in other states, nationwide. We also host caregiving sessions called Prepare to Care, which help family caregivers create their own care plans with their loved ones. And in LA, here in our backyard, we have a program called Ayudando a quien ayuda, or Helping the Helper, which is in collaboration with 211 LA and with the USC Family Caregiver Support Center, which connects Latino families and Latino caregivers with local resources. And as June mentioned, today's program is meant to be yet another resource for family caregivers. And for those of you who are professionals working with family caregivers, or you're in the journey of caregiving, during our event, you're going to hear from great panelists that will give you the tools and resources that you need and want to share with others. And as I mentioned, ARP is committed to helping family caregivers connect to resources, support, and relief in their community and through federal programs. Please visit our ARP Caregiving Resource Center at www.arp.org/caregiving to find all the resources and information that we have to offer. So with that, just a few housekeeping items. This session is being recorded and will be available on the Partners website and also through our ARP website after the session. Also, we want this to be an interactive conversation. So please enter your questions for the panelists on the Q&A box of the chat, and we'll be monitoring those questions, and we'll have time at the end to address your questions and directly to the panelists. So please engage with us, use the chat, and with that, I turn it over to June to introduce our first panelist.
All right, so with no further ado, We want to move directly to our program, and I'm very honored to introduce the first two speakers, both of them members of our work family at Partners in Care. And you know others, we have a great work family and we're looking to add to it at all times. We're a growing place. Natalie Mondon, an MSW as well, as am I, as is Adriana, is a senior director at Partners in Care Foundation. She oversees our home and community-based alternatives and assisted living waiver programs. So these are, as you will hear, challenging and important resources in the community. She's also founding member and chair of our DEI, or Diversity, Equity, and Inclusion Committee, where she provides important support. She has several decades of practice with children, families, and adults, helping them stay in the community, preventing institutional placements. She worked as a teacher. She's done parenting workshops and worked at the New York City Administration for Children's Services on family conferences for improved outcomes. She's a change leader, very, very interested in advancing equity and inclusion of our most vulnerable populations. She leads with self-awareness, mindfulness, commitment, and very collaborative thinking. She's got a bachelor's degree from Binghamton University and a master's in social work from New York University, and is an active member, I might add, in our county new Aging and Disability Resource Connection, and also NASW, the National Association of Social Work. After her remarks, you'll hear from Ariana Berta, who's an associate clinical social work at Partners in Care Foundation, who works with our Medi-Cal home and community-based alternatives program as well. That program aims to help people with very serious medical conditions in order to be able to remain at home with support of caregivers. So it's unique and powerful, and a very serious population to care for. Ariana also spearheads a creation of a support group for caregivers. And before she came to us, she was at the Semel Institute of Neuroscience and Human Behavior, and graduate assistant at the Priscilla King Gray Public Service Center in Massachusetts Institute of Technology, and a campus minister at Harvard University. So she has a long history of caregiving, took great care of her grandma with her husband. And so I'm delighted to present Natalie and Ariana, and we look forward to learning from you both.
Good afternoon, everyone. Throughout this discussion today, for advocates that are both family, friends, and professionals, we may touch on sensitive topics. This will not cover all Black, Indigenous, or people of color experiences, so please feel free to share your thoughts in the chat box or the Q&A. We hope to have a discussion following the presentation if time permits. We can go to the next slide. So as diverse caregiving, the caregiving experience varies depending on so many factors. But today we are focusing on the experience on individuals who identify in the BIPOC community. So for our BIPOC community, caregivers' cultural and historical systematic experiences impact greatly how they access and receive services. This can affect how quickly they are engaging with our community resources and are made aware of what is available to them. So we only have a short amount of time, and even if we were given hours, we would not be able to exhaust this topic. We want to again acknowledge that each individual has their own racial and cultural experience. Next slide. This slide, the research on caregiving pertaining to people of color is limited. Just to give a brief summary, here's some data from a 2015 AARP report, which collected survey data from caregivers in the US. As you can see, the data shows that the prevalence of caregiving is higher among people of color. If you are a service provider, perhaps this reflects some of your own observations in the field. Among the BIPOC community, the family takes on the responsibility of caring for their loved ones due to cultural expectations, limited access to resources, immigration status, and/or financial factors. Furthermore, because the BIPOC community lacks trust with systems, they prefer to provide the care at home to ensure the safety and well-being of their loved ones. This can cause exhaustion and further financial stress. Today, we will discuss how such factors can be addressed through communication and awareness to gain access to resources that can supplement our caregiving role. Next slide. So it was challenging to think about what we would most like to emphasize during this short amount of time, because we were reflecting about what experiences BIPOC individuals may share. Again, the phrase BIPOC encompasses such a huge array of races and cultures, which vary greatly in and of themselves. When we were reflecting on our own personal experiences and observations as practitioners in the field, we kept coming back to the role of trauma in the lives of individuals who identify as BIPOC. This is such an important topic that we would like to take some time to discuss for both caregivers and service providers who are here with us today. This is because BIPOC individuals have had higher exposure to traumatic events. This can be because of a variety of reasons: social and economic inequality, immigration, exposure to war, experiences with discrimination, and much more. Research has shown that trauma exposure has negative effects on the brain, body, and spirit. This is not to say that all people who have identified as BIPOC are traumatized. However, it is an important point for self-reflection for both service providers and caregivers. We hope that our discussion today will help providers and caregivers become more trauma-informed. This means having an awareness of the possibility that individuals may have undergone a traumatic experience, which can affect outcomes and the way that they access care. It means using strategies to work more compassionately with those who have had traumatic experiences. For caregivers, it means reflecting on the life of the one you care for and advocating for them more effectively. I'm going to pass it over to Ariana.
Thank you. Next slide, please. Here are some tips for service providers in this next section. And again, we just want to remind that the term BIPOC refers to Black, Indigenous, and people of color. So in this section, we want to discuss some tips for service providers, and these are concepts that we hope can be integrated in your organizations and shared with care managers. Of course, this is not an exhaustive list, but they are concepts that we believe are important when we reflected on our own experiences as care managers, working every day with community members. So the concepts are using strengths-based language, making efforts to build trusting and genuine relationships, reflecting on community-centered versus person-centered ideologies, and improving access to cultural and language-specific materials. Next slide, please. So using strengths-based language, oftentimes in literature, pamphlets, and materials provided to us about caregivers, we hear deficit-based language. For example, a phrase that is commonly used is caregiver burden. Providers might put out materials using this phrase, or care managers may say something like, "What can we do to reduce your burden?" While we understand that this language is used to acknowledge the very real challenges that caregivers experience, it may be alienating to cultures who believe that their role as a caregiver is a moral duty. When we work with caregivers, they say, "Of course I would do this. I wouldn't have it any other way." So if we focus too much on caregiving being a burden, it can undermine the positive meaning that caregivers derive from their role. So instead, we can make efforts to say something like, "How can we support you in this role? How can we help you be the best caregiver you can be?" And the second point acknowledges that many families live in multi-generational households with several people providing care for one person, like in my family. So we have often come across forms and applications that want the families to designate a primary caregiver, but this can be challenging and may not reflect the reality of the caregiving situation. So when possible, we would suggest modifying forms to allow space to describe a caregiving team and who performs what roles. The next point is for highlighting the strengths of the family and caregiving team out loud. So this is definitely a tip for those of us who are care managers, nurses, or those who work closely with families. Care managers have a special role in supporting a family through their experience. The family is often just trying their best and getting to the next day. As a care manager, it's important to recognize and highlight the strengths that you notice in the family. For example, it's great how you and your brother keep each other in the loop about what's going on about your mom. I think it really helped make sure that she gets consistent care. So often families are often used to hearing what's going wrong, but we can build positive relationships by saying what's going right. The next point, ask permission always and explain, is so important. This is extremely important, especially in the healthcare field. In my experience, BIPOC individuals have expressed their anger and their frustration at providers who don't explain very complicated processes or don't obtain proper consent. This is a very important point for providers to remember and take seriously, since BIPOC individuals may have experienced historical trauma of being taken advantage of by institutions. Even though we may have had the same kind of phone call 7 times today, we need to remember to slow down and to explain. For example, unfortunately, you don't qualify for this program for XYZ reason. However, there's another program that may be a better fit. It provides this, this, and this. It's also a Medi-Cal program. Is this something you might be interested in learning more about? Is it okay if I make a referral for someone to reach out to you about it? Next slide, please. So building genuine relationships. Of course, this is something that we should strive for with all of our participants, not just individuals who identify as BIPOC. However, it's very important for us to strive to build genuine and warm relationships with BIPOC caregivers, especially because trust and rapport building is essential. We want to be trustworthy and approachable as organizations. And this starts with those who have direct contact with families. In a world that is so busy, and when providers are just trying to move on to the next thing, organizations should make efforts to allow their care providers to take the time to build these important relationships. We mentioned here, go off script, because perhaps a provider has a script for incoming calls, but this script might not work for all individuals that you speak with on the phone. And we want to encourage each care manager to bring their whole selves, their diverse selves, to each individual. So don't be afraid to be genuine in your interactions with those of the same cultural or ethnic background, but ensure that you stay on task on the mutual goal. We hope that organizations can provide opportunities as well for team members to engage in a continuous exploration of their biases in a safe and non-judgmental way. It is only through this self-reflection, being able to talk through it with someone, that a care manager or an organization may be able to identify barriers to providing the best care. Next slide, please. So community-centered versus person-centered ideologies here. So it's wonderful that many organizations, especially in healthcare, have tried to incorporate language that encourages self-determination. We encourage our care managers to ask the person receiving care, what do you want? But while this is very positive and certainly should not be changed, we want to point out that this kind of you-specific language may be uncomfortable for certain individuals. What I want, especially in a care environment, can be nuanced. So many BIPOC individuals have a community-centered view of themselves in place of society. So in working with BIPOC individuals, it's important to commit to involving the family unit and engaging in family discussions whenever possible. Challenging conversations like advanced care planning are very important to have. However, we must try to encourage them maybe in slightly a different way. So instead of telling our client to discuss their wishes with their children, we may instead say something like, who in your life is important to you? In the past, how have you handled important decisions? And next slide, please. Cultural and language specific materials. So this goes without saying, but of course, care managers should continue to build resources and opportunities for language access. In addition, and when possible, provide referrals or information about cultural organizations. Organizations can also provide opportunities for BIPOC individuals to share their stories and experiences with others. They can facilitate groups and connections between those of the same cultural or ethnic heritage in order to build that sense of community. And organizations can also make an effort to make sure that their materials that they hand out are simple and accessible. Next slide, please. I'm going to hand it back over to Natalie.
Tips for BIPOC caregivers. Now in this section, we will discuss some tips for caregivers. If there are caregivers here today, it would also be wonderful to hear from you in the chat box or the Q&A. As we're talking, let us know what tips have worked for you in your own caregiving journey. The tips we will discuss today are know and tell your stories, communicate your needs, ask for resources, and prioritize self-care. Next slide. So when you're telling your story, many people are caregivers of older adults. Oftentimes, as a parent or grandparent, we may not ever have known or reflected on their past experiences or ever acknowledged that they may have experienced trauma. We encourage you to reflect on these points. Did the person you're caring for have a traumatic experience? Were they a victim of discrimination? Did they escape a war? Did they immigrate to the United States without knowing English and without connections in this country? Did they grow up in poverty? Did you experience these things? How does this affect your relationship with accessing care? Do you trust your loved ones, doctors, and service providers? Service providers are those that are providing community resources through an organization, so we all are aware. Next slide. Communicate your needs. You have likely experienced this already, but care managers might not know what you need. You might feel your loved one is just another patient. We want to encourage you to provide historical information about your loved one. Let your care team know what your mom needs, additional explanation or a translator. Let them know how you want them to refer to your loved one. For example, Miss or Mr. Munton, and or asking their gender pronouns. Let them know that they had a traumatic experience with medical professionals in the past and that you need to be with them in the room. Another tip to have all health-related information in one place, available upon request. Make it easily accessible for all involved caregivers. Maybe it's a folder in the kitchen or a box next to your loved one's bed. Make a list of the contact information of doctors and medications they are taking. Keep a list of all past surgeries or ER visits. Have a copy of the power of attorney forms ready to provide. This will help to make sure that no one misses out on providing important information and allows all caregivers to be in the loop. When possible, know your neighbors to increase your social support. Maybe your neighbor might not be able to provide care, but they may be able to help you from time to time by helping you take out your garbage bins or sitting with your loved one while you pick up your child from school. Make a list of all tasks that you need help with and allow different support systems to choose what they might be able to do. Maybe your church can bring you a meal on a Saturday night. Maybe a neighbor can walk the dog on Tuesday. If you have an extended family network, take advantage of it. Next slide. There are a lot of resources out there, but your providers won't know how to direct you towards them unless you ask. Give a detailed description of your needs and preferences, such as religion, cultural, or language. Ask the primary care physician office to help. They may be things that your insurance can cover that you were never aware of. Enroll in the email newsletters of organizations that are interesting to you. Maybe you were referred to somewhere that didn't have anything for you this month, but they might next month. Next slide. Self-care is so crucial. If there's any point that we would like to emphasize, it is this. You're entitled to self-care to combat against caregiver guilt and overcome those feelings of frustration. Caregivers have often said that they feel the superhero complex. They want to be able to do everything at all times, care for their loved ones in addition to caring for children, going to work, managing a household, and manage their own personal life. There's no positive outcome in exhausting yourself to the point of tears and frustration. Your choice to be a caregiver is an important one that is good and likely stems from a place of love and respect. If you deny yourself of an ability to take a pause when your body and spirit needs you to, you will become angry and resentful, and your loved ones one's care will suffer. Furthermore, you as a caregiver will become physically and mentally strained. When possible, plan breaks. Perhaps every month you should schedule a time where someone can watch your loved one for a day. Explore respite services. Explore care managers or doctor's offices if your loved one can qualify for a day program or respite hours. Keep moving and exhale. Take short walks around the block and or download meditation apps. Explore therapy services and support groups for yourself to remember that you are not the only one, and to work through trauma that you yourself might not have ever addressed. Next slide. This kind of wraps up our presentation today. Here you'll find some caregiver resources to assist you on your caregiving journey. Next slide. And this presentation was held by myself, Natalie Munden, and Ariana. Here is our general contact number for Partners in Care Foundation. So when you do give us a call, please ask for Ariana or Natalie. And thank you so much.
Thank you, everybody.
Well done. Thank you. Adriana?
Great. Thank you so much for that great information. And now to introduce our next speaker, Kyrie Pollock. who uses the pronouns she and her, is the director of the senior services at the Los Angeles LGBT Center since 2017. Kira oversees residential and non-residential senior services for more than 5,000 senior participants age 50 plus each year. Her responsibilities include oversight of Triangle Square, the nation's first LGBT affirming affordable housing community, the new 8,000 square foot Harry and Janet Weinberg Senior Center, and the Ariane Getty Senior Affordable Housing on the center's 1.86 acre intergenerational campus. Since 2018, Kira has served on the Los Angeles County Commission for Older Adults and currently is the vice president of the commission. In 2013, the Los Angeles LGBT Center was awarded the Rosalind Gilbert Innovation in Caregiving Award at the American Society on Aging Conference. And before I welcome Kira to address you, we do want to recognize it is Pride Month. So happy Pride Month to everyone. And Kira, please join us.
Thanks so much, Adriana. And I just want to take a minute to just thank Partners in Care Foundation and AARP for inviting me today. I'm just going to spend a couple minutes talking a little bit about what we do at the Los Angeles LGBT Center to provide sort of a context for our work with caregiving with older adult populations. The Los Angeles LGBT Center is the largest LGBT center in the world. We have more than 800 employees, and we focus our services in a number of different areas, but kind of in health services, we have a federally qualified healthcare center in Hollywood, as well as 6 other locations across Los Angeles where we're providing healthcare services, both primary health, sexual health services, mental health services, psychiatry, kind of a full service healthcare center for our community and our population. We also provide social services and supportive housing to older adults, youth, transition age youth, 18 to 24-year-olds, legal services, education, policy, public policy work, leadership, advocacy, and a multitude of other services kind of across the board. Our goal is really to provide comprehensive services to our community with a goal of really making sure that the LGBT community is healthy, equal, and complete. That is our mission and our values. Adriana, you can move it forward with the slide. A little bit about our senior services program. So we work with older adults that are age 50 plus, so 50 to 100. We have a couple of folks that are just nearing 100, which we can't wait for in our program. We have a senior center located in Hollywood, which is also funded by the City Department of Aging. So we're part of the aging system of care for the city of Los Angeles. So we have a mini multi-purpose senior center located in Hollywood. And we provide a great deal of different support services to our older adults, everything from support groups to health and wellness activities, case management, housing navigation, caregiver support, employment assistance, as well as kind of a pretty robust meals, farmers market, pantry program for our older adults. And flyer on your left tells you a little bit about our social connectivity program that we have, where we pair younger folks in our community with our older folks to have really great telephone conversations through our Hello Club program. Next slide, please. We have 2 affordable housing buildings for older adults age 62 plus. So we have about 250 older adults that are with us in between those 2 housing buildings. Just some pictures of it, just so you can get a sense of it. Next slide, Adriana. A little bit about the LGBTQ community, of which I'm a member. So we have 2 to 3 million LGBTQ older adults in the US that are age 50 plus. That's kind of based on both survey results and estimations across the board, because census data does not cover sexual orientation. So these are kind of our best estimates. We are anticipating that by 2040, there'll be 7 million LGBTQIA older adults age 50 plus in the United States. And kind of comparing that against the data of what we know of folks being diagnosed with Alzheimer's disease, we can estimate that there's at least 350,000 LGBTQ older adults that will have experienced or have been diagnosed with Alzheimer's or related dementia. And I bring that up because it's going to be a thread throughout my conversation about some of the needs of our caregiving community and how dementia and Alzheimer's affects some of those caregiving needs that are kind of specific to the LGBTQ community. Our community certainly is at risk, and it is an underserved community, and I'm going to talk a little bit about some of the data that supports that in my next couple slides. Go ahead. In the LGBTQ community, our older adults are less likely to marry or have children, which places them in a situation where they're less likely to have caregiver support as folks are aging. They're 2 to 3 times more likely to live alone. So that kind of isolation is more prevalent overall in our community, which impacts when folks get older and they need more assistance and potentially need to find a caregiver on their own or figure out who can caregive for them as they get older. They have little to no caregiver support unless they're partnered with someone that can help caregive for them. And there's a lot of stigma, discrimination, and trauma in our community, both because of sexual orientation and because of the history of oppression that our community continues to experience. Not all of our older adults are out in all aspects of their lives as well. There's an enormous amount of fear of discrimination, both perceived fear and real fear in their experience. And for many of them, that is very persistent and in many ways becomes more intense as they get older. As folks get older in our community, we face the possibility that we might lose different rights and different levels of independence. And for that, that kind of facing of that aging process for us, it becomes even more concerning as our older adults get older, because facing nursing home possibilities or assisted living, those kinds of locations and higher level of care means the possibility that they will feel like they need to go back into the closet because those facilities and or the other folks in those facilities may not be LGBT friendly, and they may experience increased discrimination. Now, how this plays into caregiving is really important because many of our older adults are very concerned that should they need caregiving or caregiver services, that will be place them in a situation where they might need to go into a higher level of care at some point because of how they're functioning. Those concerns mean that they are less likely to reach out to get caregiver support as they're aging, which places them at increased risk. There's also a great deal of intersectional identities that our community experiences day to day. So the experiences of oppression by sexual orientation is not the only thing that our community experiences, but the layers of identities for folks that are African American, who are transgender, who experience even more discrimination throughout our community. If they appear to be less comfortable for other members of our community in terms of how they dress, how they act, all of those things place them at increased risk of violence, which feels very much for many folks like their risk level in many ways increases as they get older. Now we know that ageism gravely impacts how folks experience the world around them. And as folks get older, they feel like they are more likely to experience violence and abuse, or that other folks will not help them, right? So that vulnerability comes through more as folks are aging, which impacts their ability to seek medical attention, get diagnosed if they have memory issues, get connected with caregiving and other kinds of supports. Next slide. In terms of social isolation, in our community, older adults are 14 times more likely to report loneliness, which gravely impacts, again, their ability to access other kinds of services. In an AARP study that came out recently, half of those folks surveyed identified as LGBTQ were classified as lonely versus 35% of straight people. So the rate of loneliness is much higher in this community and of isolation overall, which is why I think the services that we provide at the center are so important. As the only LGBT specific program for older adults in the county and city, we are really the one-stop location for most of our community in terms of comfort, safety, and support as folks are aging. We're the place that folks come to the most for those kinds of help. Next slide. The other piece that I think is extremely important to talk through is resilience. So our community knows resilience very well because of the oppression that we experienced. In our community, the HIV crisis and epidemic gravely impacted a large amount of our community. Folks lost their partners, their entire communities of support, all of those things. But what they also experienced with that trauma was the informal networks of chosen family members that came to help support you as the community was experiencing a tremendous loss. Something that you can kind of equate slightly to the COVID crisis, although not the same. So within that crisis, many of our older adults were able to reach out to other members of our community and get supports, from meals to folks coming to the bedsides of others, to being able to have kind of informal caregiving supports that were entirely part of that movement to help support folks through the epidemic. As folks are aging in our community, that resilience has come through in that we see most often in our community that peers are caregiving for peers the most, because again, most of our folks do not have family support or partners necessarily that can support them. There is some pros and cons to that chosen family support, in that when you have aging peers supporting aging peers, they can't always continue that caregiving journey with someone because of the age and the other kinds of difficulties that they may experience for themselves in terms of their own health crisis and things like that. But on the resilience side, often that community is not just one person. So it's a group of folks that are helping to support each other with food, with calls, with check-ins, with driving to the doctor's office with them, all of the things that you would see maybe one child or parent or a niece or a nephew covering in sort of a normal relationship. In our community, we see groups of folks kind of coming together to help support folks that are struggling as they're aging. Next slide, please. When we look at kind of resources overall, there's been a good deal of research that's been done through Alzheimer's Association, through SAGE as well, really looking at the needs of older adults, looking more specifically toward dementia, but also, how caregiving and dementia kind of correlate together. So we definitely know that there's increased rate of dementia in our community, that also some of the effects of HIV medications can look and experience very much like dementia for our older adult populations. And there's a lot of need for diagnosis around dementia and resources. So what we've done at the center through our federally qualified healthcare center is that we really have shifted in the last 3 years toward trying to make our health center an age-friendly healthcare center. And we've done this through screening for dementia and related memory and cognitive impairments, so that we've begun for the last 2.5 years to screen everyone through our program who are 50 and older every year as they come in for their medical visits. This has really, allowed us to create baseline data on what folks are experiencing and helped kind of move us forward, I think, toward normalizing what memory issues look like as folks are getting older, and help put in place earlier those caregiving supports, help bring that family, that chosen family concept together to make sure that folks are successfully aging as much as possible. Next slide. Next slide. There's a couple different supports that I wanted to talk through. One is the Aging with Pride study. If folks that are on the call are interested in this, it is a dyad study with both the caregiver and the care receiver. And it's one of the first studies that we've really seen that is looking at tracking how caregiving and with folks with dementia or memory issues interplay to help folks successfully thrive. It's done through the University of Washington, with Los Angeles being one of the target sites out of 3 across the US that are really targeting testing this evidence-based program to determine kind of its effectiveness within our community. Now, very often research studies do not study LGBT populations, so I'm really excited about this study, and there's great information on the web about it. If anyone's interested in enrolling, you can enroll yourself online. And it's LA specific, and we're a partner in this project. Next slide. Support groups, I think, are extremely important to help folks on a day-to-day level. I think it helps provide that help and that really connection to each other as folks are struggling. So our program has a twice-a-month support group for folks that have experienced a memory issue, whether it's Alzheimer's or related dementia. But also it's really open to folks that haven't been diagnosed with a memory issue for that level of support within our program. So you can join it at any time. There's some information here about it as well. Next slide. Our program has also been utilizing the Savvy Caregiver program, which is an evidence-based program to help support caregivers that have either a loved one that has dementia or a memory-related issue, or just to help folks be educated on dementia or memory-related issues. Next slide. We pilot tested this program and did pre and post testing. Overall, had some really great results with folks feeling more positive about the caregiving role that they've had, feeling less depressed, and feeling more able to manage as a result of participating in that program. Next slide. All of our folks that have participated have really said that the program was really able to help them provide more skills, feel more confident, and more able to help caretake for the person in their life. Next slide. Just a little bit of information. We did partner with USC's Family Caregiving Support Center. And this past year, a couple of months ago, I did a panel presentation with other LGBT caregivers. You can watch it here. It's a great video if you have the time, talking about the experience of LGBT caregivers in the caregiving relationship with actual participants. It was a great thing. Folks are always reaching out to me to talk more about it. And so I would just encourage, if outside of just today's presentation, if you're really interested, it would be a great thing to watch this. It's like an hour-long YouTube video if you have time to watch it. Next slide. Just a little bit of information on our services. If anyone's interested in registering, who's not registered with us, you can do that online and get kind of all of our different programs and services emailed to you or mailed to your house in our newsletter every month. Next slide. A little bit of just recommendations. I think screening is really important, especially with folks that have memory concerns. And I think the more that we can do that, the better. I think very often folks are hesitant to do those things. And I think the more that we can do it in a variety of different settings, the better that can be. Helping provide information and education, helping remove those barriers to services for populations, especially the LGBT population that's especially isolated. And helping kind of bridge those gaps and informed, kind of help connect those chosen family members to those supports. Because very often folks that are informal caregivers don't see themselves as caregivers, right? They don't use that word. They think of themselves as friends, as as folks that are helping out, as all those other kinds of ways that we talk about things, they don't necessarily think of it as caregiving. So, you know, traditional programs that are reaching out to folks using the term caregiver is not necessarily going to work well in the LGBT community. You have to be broader in the way in which you market your materials, that you talk about what you do, because the supports are still really needed for these different kinds of caregivers in our community. They're just different in terms of the way in which they experience that work. Last slide. Just a little bit about me, which we already read about, but if you need to contact me, my information is on here as well. And thank you all so much.
Well, that was outstanding, Kira. Before we move, just a brief transition, go back to Kira's slide. I'm just interested in when the LGBT Center was formed. Do you know?
Yeah, so we are in our 53rd year.
Because I remember when there wasn't one.
Mm-hmm.
So I guess that makes me 54.
Absolutely.
And the amount of change that has occurred, because I knew a couple of people who helped found that when there was nothing. And I'm speaking as a founder. Partners in Care didn't exist, and now it does. And I'm listening to the excellent presentations earlier with Natalie and Ariana, and those are issues. These are issues we didn't have this kind of open discussion about in the past. Even racism, I think, was just not as openly debated. Maybe it's debated now, it's kind of come out in the open. So I am particularly appreciative of this session that Adriana and others helped invent, because this session didn't exist before, and to remind all of us in a time that calls for action, that calls for positive change, the kind of powerful resources that have been developed. We're going to hear some more, because we'll hear from Children's Hospital of Los Angeles next, which we at Partners in Care also adore and respect so deeply. So I want to thank our prior presenters, and have the pleasure then of introducing Dr. Aurora, who was the Chief Medical Officer of Children's Hospital of Los Angeles Care Network. This hospital also, although it is older, I don't know how old is the hospital. Do you know, Dr. Aurora?
It was started in 1901.
So there you go. It's deep in our community, has evolved dramatically, but it's also a cherished, wonderful resource, a key part of safety net that does serve the whole community, especially those in most need. So, we're very proud to have you here, Dr. Aurora. Dr. Aurora really has demonstrated also, as our prior speakers, passion about elevating the health of communities. And she's looking broadly about building ecosystems that really support the people who give care, the people who receive care, and their families, and has a particular focus, which I think, again, is in the pioneering zone, because we didn't used to address these issues so broadly and with such depth. She's working on addressing the mental health crisis, the rising rates, which really, when you just think about our world today, it's not too surprising that we have rising rates of anxiety, depression, suicide, and substance use. These are just powerful themes. So Dr. Aurora has been working at empowering and forming collaborations with pediatric primary care providers and specialists at Children's Los Angeles to really help them manage the patients that they see in their offices and communities, and working with pediatricians in the community to really advance much needed treatment for the mental health needs of patients that I think we used to give more strictly medical care, and yet now we see the social construct. Now we see the power of these emotional and mental health issues. So she's working to help people access what we just heard about in the LGBTQ community, need for peer-to-peer consultations among leaders and among those cared for. Peer-to-peer consultations with child and adolescent psychiatry in these cases, facilitated referrals into outpatient behavioral health services. So she works at the state level, the California Children's Hospital Association, across other hospitals, really looking for systems change, because this is all about a broader view of people, the suffering, the risks they have, the solutions that they need. And so before Dr. Aurora came to Children's Hospital of Los Angeles, she was looking at utilization management, chairing the Department of Pediatrics for the Providence Health System, also very dear to us at Partners in Care. We work closely with both of these healthcare systems, trying to align our social care resources with them. So, of course, with all this passion and depth of innovation, Dr. Aurora has all the top credentials, board certified in general pediatrics, trained at the Mattel Children's Hospital, UCLA, and what some of the bolder medical pioneers, she's dually educated with a master's in business administration from University of Massachusetts in Amherst. So she'll be very exciting to hear, and then you will also be hearing from Jennifer George, who is a licensed clinical social worker and had got her education at UCLA and has an MSW like a number of us on here, and has been a hands-on clinician and researcher and lecturer. She's currently, you may have seen her last year, I think it was, on the Oscars, when the Motion Picture and Television Fund received a special Oscar for their services. She's the director of community social services there, where she's worked for 15 years and really oversees the, we take care of our own is their theme, very serious, and gives great leadership. And also for us, works closely with us on training people to work with older populations and their families. She's the chair of our Geriatric Social Work Education Consortium, a regional program. So we are really honored to have both of you here. Let's start with the esteemed Dr. Aurora and hear about hers, and then we'll move to Jennifer after that. Thank you both for being here.
Well, thank you for that amazing introduction. And again, I just have to say the speakers before me were quite spectacular. So there's some great, amazing work going out there in the community, and I'm excited to be here. As you can imagine, Children's Hospital Los Angeles, I'll give you a sense of our programs, but we have hundreds of specialty programs. And so I will not be able to go through every one of them, but I will have some information at the end of my presentation where you can definitely inquire about our specialty programs. And so I want to start with our mission, vision, and values. We at Children's Hospital Los Angeles, as June said, we are a safety net hospital. 70% of our population is Medi-Cal and underserved. We are deeply grounded in our mission of creating hope and building healthier futures. We also are very committed to training those who will be the future of child health and supporting our communities, especially those that are underserved. Our vision, which was recently put together with input from all of our staff and our physicians, is really we will be the pediatric health system of choice by offering transformative, compassionate care and life-changing discoveries. And we also do remind ourselves before every meeting about our values, that we achieve our best together. We're hopeful and compassionate, and this is especially true as we made our way through COVID and all the challenges that all of our staff, physicians, patients, and families were having. We really made sure that we started each meeting telling ourselves and telling others that we are in this together. We are doing our best together, and we are hopeful and compassionate that we will get through this. And we are slowly making our way through this. Next slide. So we were started in 1901. As you can see, this was our first hospital, if you can call it that. It was a house that was converted, is now in Chinatown. We had 14 patients that we cared for in the first year. The surgery suite was in a converted pantry. And then we moved to our current location in Hollywood in 1914. Next slide, please. So we have many different pillars to our to what we do as an organization. One of them, of course, is the expert clinical care that we provide, which is deeply grounded in quality. It's patient and family centered. As you know, and we are talking about caregivers, it's not just about the child. It is about their family. It is about their grandparents. It's about their siblings who really at times don't get as much attention, or in the hospital with their sick siblings. So we really have care that is all encompassing across the entire patient and family. And all of the care that we provide in terms of family conferencing, rounding on our inpatients is again involves our patients and their families as we do our morning and sometimes our afternoon rounds. We have 413 active beds. We have thousands of discharges and surgeries that we do annually, lots of patient visits, and we have several medical staff members and employees. So we are very busy on a daily basis and an annual basis. Next slide, please. So we are ranked number 5 in the nation as a children's hospital. We are a freestanding children's hospital. And to clarify, most people, well, some people think that we're part of the UCLA system, Mattel Children's. We are not. We are a freestanding children's hospital affiliated with USC. We are ranked number 1 in the Pacific region and number 1 in California. We have a very prestigious magnet designation, which is a nursing designation. We're also ranked number 5 in the world and number 3 in the nation. So we have many, many different clinical recognition awards, which I will not go through all of them, but definitely amazing staff and physicians that are committed to high quality care, really committed to these children that we serve on a daily basis in our communities. Next slide. So our other pillar is research in terms of providing transformative care. It is not about just provide clinical care that is grounded in current evidence. It's about research to define and to inform care in the future. So we have 14,000 research visits annually. We have many, many clinical trials. We have 4,000 patients enrolled in our clinical trials, a lot of funding from NIH, and we have a lot of research funding, $168 million. So really our faculty is committed to not only providing clinical care, but research as well. Next slide. A lot of our research takes place in the Saban's Research Institute. This is not the exclusive place where it takes place, of course. It remains one of the largest and most productive pediatric research centers in the Western United States. We do basic research, translational research, so the basic research that then goes into how we change treatment, how we change that into new drugs and devices. And then clinical research, which is about the effectiveness of medications. And lastly, community research, really so that we can integrate community members in the design interventions for policy and social change. So a number of our clinical trials also have community members that participate to ensure that it is informed by our communities. Next slide. So we have, at the center of it, we pioneer discoveries to promote healthy future for all children. We really want to identify early interventions that can change the life of our children, so that if they do have risk factors, we can intervene early so they have very productive lives. We want to make sure that we change this knowledge into innovation that honestly is very limited in pediatrics, more so in adults, but not as much in pediatrics. and really have personalized prevention and care, really go to a cellular and genetic level to inform care that is personalized to that particular cellular and genetic level. And then also to understand the underlying causes of pediatric disease so that we have new intervention and cures. Next slide. So we also focus a lot on our education, pediatric education. We have a 23-year history of preparing nurses. And many are in nurse residency graduates. We train many pediatric specialists and subspecialists, and 96% of them pass their boards. And in terms of our residency graduates, we have 4 to 7 applicants per open position. We really, really want to make sure that we train the future pediatric workforce. Next slide. So as you can see, our pediatric residency program, nursing residency, fellowships, medical students, numerous programs. These are only some of the programs that we have in place for training. Next slide. And just to let you know, in terms of our footprint, it is not just our main campus in Hollywood. We have 6 ambulatory care centers where we do have our pediatric specialists provide care, so that, again, it really is about providing care closer to home within our communities as much as we can. As you can imagine, it's not as easy because there aren't as many pediatric specialists as there are adult specialists. So we do have those 6 of our care centers in Arcadia and Bakersfield, Encino, Santa Monica, South Bay, and Valencia. We also partner with our pediatricians in the community. Our Children's Hospital Los Angeles Care Network has 229 pediatricians across 5 counties and 40 cities. We serve 432,000 children. And this really is an effort to take the expert pediatric care we have in main campus and bring it out into our communities and ensure that we can partner with our pediatricians to provide the same care that we believe is evidence-based and high quality. Next slide. I am going to make a plug for our fundraiser that is coming up on June 25th. It is walkandplayla.org. Well, it's Walk and Play LA. You can get more information on the .org site. It's a 3K walk. It's a family festival that includes sports clinics. We have, of course, our celebrity hosts that will be there. And if you want more information, please do go to our website where you can get more information too, and hopefully you can participate. You can do this virtually or in person. So you do not have to do the whole walk. You can do it virtually as well in terms of the fundraising. Next slide. That is it for me. I know this is a very quick overview of a very complex organization with multiple programs. You can refer if you are referring providers, and the information is provided there. If anyone wants more information, our provider relations outreach team can be reached at this email, and we will return your email as soon as we can. Thank you so much.
Fantastic, thank you.
Good afternoon, everyone. Again, I'm Jennifer George. I'm the Director of Community Social Services at the Motion Picture and Television Fund. And I just want to start out by thanking Partners in Care and AARP for having me here today. I'm really delighted to shine a light on caregiving in the older adult population. And whether you're a provider or you're a direct caregiver, I hope to convince you by the end of our talk today that this is really a universal occupation. Next slide, please. Before I jump into that, a lot of folks don't know who MPTF is. Last year we turned 100. We're one of the oldest health and human service organizations in Los Angeles County, and we provide services to people in the film and television industry who work both in front of and behind the camera. Most people know us from our 40-acre retirement campus out in Woodland Hills, where we have independent living, assisted living, skilled nursing, a secure dementia unit, an award-winning palliative care team, outpatient geriatric clinics, and a behavioral health unit. And every year along with that, we provide services to community dwelling, older adults and other folks across the lifespan by providing intensive case management and clinical wraparound services. When we think about caregiving for older adults, historically, when we look back in time, in the 1900s, old age was about 47. That's about as long as you could expect to live. And caregiving was really left up to the family, particularly women. And it was done within the privacy of the home setting. And it was taken on by the community, village, tribe, you name it. Because the trajectory of how we get sick and how we age has transformed and changed. It used to be that you got sick, you got tuberculosis, pneumonia, some intestinal infection, and you died very quickly. And so the length of caregiving was very short, and it wasn't really seen as a public health crisis as it is today. Today, we know when it comes to providing caregiving to the older adult population, that informal, unpaid caregivers really are the backbone of the long-term care system. Next slide, please. Right now, what we are experiencing is kind of the perfect storm when it comes to caregiving and the older adult population. We know that you may have heard the word silver or gray tsunami. We're having the unprecedented growth in the older adult population. By the year 2050, about 1 out of every 5 Americans will be over the age of 65. It will be the first time in the United States where older adults outnumber children under the age of 5. At the same time, within that older adult population, we're becoming increasingly diverse. And at the same time, we're really experiencing the fact that the oldest those people 85 plus, are the fastest growing segment of that population. And we know as we age, there's a greater likelihood that we may need care at some point in our life. At the same time, although we're living longer, we're not necessarily living a more healthier lifestyle. We know that most individuals live and age with 1 or more chronic health conditions. Couple that with the increasing rise of Alzheimer's disease and other forms of dementia, we really have this perfect storm where we know that the need for caregivers is going to be greater than ever before. Because of issues around ageism, our fear of talking about growing old. Here in the United States, growing old is something we want to try to defy. All you have to do is walk down a cosmetics section and you see all sorts of age-defying products. Rather than something we embrace, we're not having the types of conversations that we need to have to plan for growing old. And therefore, we're not putting all of the pieces together so that we can think about what our care needs are going to be in the future. Next slide, please. And so I think this is a beautiful quote by Rosalind Carter that basically really, takes home the message that caregiving really is a universal occupation. You pretty much can expect that at some point in your life, you either will be a caregiver or you will be in need of care. And so we know that, the need is growing and that we need more people to fill those roles. Next slide, please. I like to put this slide up because I think, as some of my co-presenters were talking about, it's very difficult for caregivers to self-identify as a caregiver. As a professional, we think of activities of daily living and instrumental activities of daily living, bathing, dressing, toileting, help transferring someone, grocery shopping, helping someone with their medication. But for folks that are just doing this on a day in, day out basis, they don't necessarily see themselves as a caregiver. And so sometimes just having the visual depiction helps people to realize, oh, I'm doing this. And caregiving can happen overnight. It can be really sudden and you don't realize you're doing it. All of a sudden, on a rare occasion, maybe you bring your neighbor a hot meal. And then you realize once a week you're doing this and you've been doing it for the last 3 months, for the last year. And so sometimes we're not aware that we are actually acting as a caregiver. And as we heard from our first panelists, I think a lot of folks just see that, particularly when it comes to the older adult population, as just something we do, right? Of course, I'm going to care for my mom, my dad, my aunt, my uncle, my spouse, my partner. And so it's hard to sometimes connect to that term caregiving. Next slide, please. I think because we live in a society where there is a lot of ageism, we tend to think about older adults as the recipient of care. And by all means, that is true. Older adults are in need just by sheer number of how many there are and how many there will be. They will need of all kinds. But the reality is that older adults themselves are also caregivers. When you look at the caregiving population, a significant swath of that population are older adults, so people 65 and older who are caring for other older adults, usually a spouse or a partner. What we don't talk about as much is that older adults often are taking on other caregiving roles. We're starting to talk more and more about how older adults are the primary caregiver for their grandchildren and have really assumed those roles and responsibilities. And another population that we don't talk a whole lot about, and there's starting to be a lot more research about, are older adults who care for their adult child with an intellectual disability. And this is a very unique population where there's not an abundance of resources, and we're starting to really see that the needs of this population in particular are emerging. Next slide, please. When we talk about older adults, we also have to talk about the sandwich generation. And this is a really unique group of people. Most of them are baby boomers, so people born between the years 1946 and 1964. And by the way, since the year 2011 up until the year 2030, every day about 7,000 to 11,000 people are turning 65, and that will continue into the year 2030. And these folks have found themselves in the position that oftentimes they are responsible for caring for themselves, but also their parents. Because people are living longer than ever before, people are caring for their own parents, sometimes even their grandparents and their children, whether that's providing direct care or financially supporting. And so this is a very unique subset population who's really has all the plates in the air. They're trying to juggle their home life, their family life, their financial wellness, their mental health, and take care of themselves. And the sad reality is that we know that it's not atypical for caregivers to die before the care recipient because they are not able to find the time to care for themselves. They are hypervigilant and they are just focused on their care duties. Next slide. Thank you. I put this slide here because I think sometimes this is a very taboo topic. You know, I think there are many different feelings that come up about being a caregiver. There's much joy and love and opportunity, and a lot of people feel fortunate to be in that role. But this is difficult work. This is difficult to show up in that space. You know, again, it's not uncommon for a caregiver not to have gone to the doctor. And so, you know, anytime we're talking with a caregiver as a social worker, we're constantly asking, when was the last time you saw your primary care physician? What is your sleep like? Well, how are you eating? How is your mood? Because we know that the impact of being a caregiver is very significant. And so I like to also put this slide up just because if you recognize any of the signs or symptoms here, you may be experiencing some caregiver strain or stress or burnout. And this is a good segue to ask for help or to seek services or to maybe think, maybe I need a little help here. Maybe I can't do this all by myself. And that's hard to come to that because I think we want to be that provider of care for the people that we love and care about. Next slide, please. I think it's really important as a provider to be able to give caregivers a toolbox of sort. And one of the biggest things I think we can do is normalize and give people permission to ask for help. It is not easy. I think we really underestimate how difficult it is to ask for help. And so it's really critical that sometimes we model that, we give permission, we encourage that, we check in. And so as a provider, I think that's something we need to do more of. And I also think we need to encourage our caregivers and teach them how to ask for help. We also need to be able to provide information. That can be information about a particular disease trajectory. I think sometimes caregivers I've heard things like, I don't know why my dad is constantly doing that. I think he's doing it just to annoy me, when really it is a symptom of the disease that they're experiencing. And so sometimes providing information, as long as that's something they want to have, helping with planning, things like advanced care planning, advanced directives, those things are really important and critical conversations. You heard Kira talk about the need for support. We know when it comes to caregivers, support groups are incredibly advantageous to hear shared experiences. Because of COVID, it has created some opportunities for more telehealth. And so these opportunities are more robust. And then of course, respite. We know that you can't be the train constantly going, that sometimes you need a break. And we're not suggesting that that's a 14-day vacation to the Bahamas. It could be 30 seconds of deep breathing. And so sometimes we really have to train our caregivers of how to take those moments and how to let a little steam out of the kettle so there's not a big eruption. And so these are just this is just one example of a caregiver's toolbox that we can give as providers. Next slide. The unfortunate news is that there's no exact recipe or formula or guidebook of how to do this correctly, how to be the best or super caregiver. The reality is we're all learning as we go. And as we heard, needs are so diverse that they really need to be person-centered. And so what you have here are just some general resources from some different organizations that provide services both to caregivers and care recipients, whether that's respite care or a social connectivity program or a food delivery program, depending on your unique needs, your unique situation, geography, social economic status, all those things go into the formula. And it's not expected that you are the master of that. It really takes a professional to help you navigate that. And that's part of that asking for help. Next slide. Thank you. Here's my contact information. If you have any questions, feel free to reach out. You don't have to be someone in the film and television industry. We'll help anybody who calls us at MPTF. You have my direct contact information as well as our general information. Thank you so much.
Great. Thank you, Jennifer, and all the panelists. I'm just overwhelmed with all this great information, and just thrilled to be part of this amazing work group of not just organizations here in our area, but just institutions. We're talking about Children's Hospital over 100 years, the MPTF over 100 years, the LGBT Center 54 years. June, I think you're the youngest at 25, but you're getting—
I know, we're just like the innocents here.
Great. So just thank you everyone for all that great information. And as we wrap it up here with questions, let me just say that part of putting an event like this together, it takes a lot of folks, and the Partners in Care Foundation staff have been amazing, Ellen and Karen and others. But it is challenging to bring a program like this and address all the issues that, the greatest challenge for us was, first of all, how do we define special populations? How do we define diversity and inclusion? And I think we did our best in just bringing you a brief overview. We will be sharing other resources. And one of the issues that did come up with one of the participants is a question around the aging population, specifically caregiving with the intellectual disabilities, developmental disabilities, and autism spectrum disorder. We not intentionally left it out. We did have a conversation around it, yet that would be a whole session in itself. But Jennifer, you did mention that as an emerging population that we need to pay attention to. Do you have any other specifics, more info on how just turning people to a resource that can help them?
I think the regional centers are always a great resource to have. I think for older adults who are trying to plan for their children who may have an intellectual disability, as early as possible, setting up a special needs trust, speaking to, someone in legal services, it's very complex. And so this is an area where you really need to go to some of the key experts, and it takes a little research, but I think any organization that you've seen us talk about could help get you there to those resources.
Great, and we'll definitely include the regional center information for all of you. Let's see, we do have a bit of a shy group. We do have room for questions. I have one myself, actually. So I think the theme here was caregiving, it's specific to each individual based on the population or that you represent. So I work specifically with the Latino community, and I mentioned a program that we have here in the LA area called Helping the Helper. And we've done some research and data that has indicated to us that Latinos overall don't identify themselves as caregivers. And of course, that's a challenge for you or anyone here who's in the serving this specific population. And I'm not going to assume that it's the same for other demographic groups, but I do know that it is the case for Latinos because we have that data and information. How do you provide services to a group that doesn't even identify themselves as part of that group? And I think maybe Natalie, Ariana, or even Kira, or any of you can answer that, because you mentioned it, Kira. It's also the case in the LGBT community that folks don't identify as such, yet you have tremendous services at your center. I mean, that's, so I guess that's a long question to ask, but if anyone, as we wrap this program today, want to address that.
I mean, I think for us, it's really about having those longer conversations to get a better sense of how folks are caregiving and in what ways, because you don't identify them as caregivers with them self-selectively volunteering to use that term. You have to kind of dig into the conversation, and sometimes it will come across more for us as someone calling because they're concerned about a friend, or because they're starting to feel exhausted by taking care of someone, and they're trying to figure out what other supports are available. So you have to really dig into the kind of conversation to get into what's going on around their situation and how you can help support them.
Got it.
I agree with Kara. I think you have to sit down with them and ask them what does it define them, and then help them to understand what it means and give them, hey, this means caregiving. So that sit down conversation and define it for them what the role is.
Got it. All right, bring us home, June.
Well, I do want to thank the team that planned this, including you and each of the speakers. I think it's kind of a love story that we're hearing here. And we're hearing really it does take a village. So as you look at someone who's having a health issue, if you look at who's around them, whatever label they may or may not take, we know that watching people face health and functional challenges is serious. It's maybe underdescribed. As someone has, I got a call yesterday, someone had terminal cancer. So then everyone rises because we know, okay, this is a short term, but as we were hearing here, it can be a very long and gradual trajectory, or we were hearing about autism and so on, a very long trajectory that changes over time. What we know is we all need to help each other with things that just look like they are just family issues, or just what people face. But it is really important to reach out, to let people talk about things that may be not the smiliest content that they bring, because we want them to be able to have a place to talk about what's challenging in order to get support. So I love that we have these fantastic organizations, as you could hear. Each of these, it's a great honor to be in your company and to hear what you do and what you put in place and continue. You can hear that this is a continuous form of pioneering, innovation, learning from the people we care for. And so I think it's, to me, very inspiring in a world where, you know, we can listen to the news and look around and there's a world of hurt, there's a world of love, there's a world of commitment. And the people we're hearing today, you know, Natalie and Ariana and Kara and Dr. Aurora and Jennifer and Adriana, these are people whose lives are lived to really advance a caring world, a world that reaches out and respects and supports and invests in other individuals and in systems of care. So I would, if we were all in a room, I'd give you a standing ovation for your knowledge, your skill, the work you do, and the heart you bring to it. So we want to thank each and every one of you so much. Partners is so aligned with the spirit that you bring. And we want to thank you very much. And thank all of you who took the time to be here and share in this learning. And tell your friends they can tune in on the website. And you could, we're seeing, join us for an event that's coming up to honor other heroes, honoring Dr. Southam and Dr. Jane at our tribute dinner on the 20th. It's a signature event for heroes in a world where people who give care as their life's work are recognized, and we want to give the same recognition to each of you today because that's who you are. So thank you very, very much for being with us. Partners in Care Foundation thanks you. Take care and be safe. Please sign up for our emailing and help us tell the story about future opportunities like this to learn together and to support each other in that process. Thanks so much. Thank you, Victoria. Thank you, Ellen. Thank you, Karen. Take care. We thank you for joining us.